Hi, everyone. My name is Gladys Rodriguez. I am a gastrointestinal oncologist. So I treat patients who have pancreas cancer, esophagus cancer, stomach, colon, and rectal cancer at Northwestern.
And my name is Manella, and I am a registered dietitian and clinical exercise physiologist at Northwestern. I specialize in GI oncology as well, too. So I'm excited to be here to talk about nutrition during cancer care.
Thank you, Hannah, and thanks so much for joining us today. Nutrition is so important for cancer care. And in my patient population, patients who have a GI cancer, I hear about their concerns almost on a daily basis. And so addressing nutritional issues is always a priority for me. And I know I do send you a lot of my patients too. So I thought this would be an important topic to cover, especially because cancer and the treatments we use to treat cancer, like chemotherapy, they alter the way patients eat. And so let's get started. And so in your opinion, why is nutrition important during cancer treatment?
Yeah, absolutely. As we know, some of the most common side effects of whether it's chemotherapy or radiation therapy are the impact for individuals to be able to eat normally, whether their appetite is impacted or they have a different functional GI tract or they're having side effects that make eating less desirable. So the goal of nutrition during cancer treatment is to work through those side effects and to help people find strategies to make eating a little bit easier. Because what we find is if people lose weight without trying during cancer treatment, it tends to pull from their muscle stores rather than their fat stores. And this leads to a variety of complications, whether that is decreased functional status or treatment complications or treatment delays. So we really want to make sure we are helping people maintain their weight and maintain their muscle during treatment. So we come in, we help people eat, we help make eating more appealing and easier to tolerate during treatment.
That's so important because I do have patients who come in who haven't been able to eat much. They lose weight and we can't treat them. And so you're right. We end up delaying treatment. And sometimes that's not the desired outcome for us or for the patients. And as I mentioned, for me, it's so important. And so I almost always refer a patient to a nutritionist or dietitian, to you specifically, a lot of times. But in general, when should patients be referred for a nutrition consult, or when should they request one?
Ideally, individuals should meet with a dietitian either at their first treatment or even before they start treatment. So then we can talk to them about expectations, what their treatment side effects could look like, how to prepare in advance, can they do a little bit of meal preparation or have some more different type of groceries on hand to make it easier on them. Otherwise, at least within the first maybe 2 or 3 treatments, a dietitian should be available to help identify and help target those side effects as they're starting to show up. So sometimes it is nice to see people after a treatment or two so we understand, what side effect is that person experiencing, and then we can come in and tailor an intervention at that point too.
Right. And, as we mentioned, we both work with patients who have GI cancers. And I was wondering, what are the most common issues or concerns that patients tell you about for the specific types of cancers?
Yeah, so the 3 that are listed here, they're all very different, and I love it for that reason. So from a pancreas cancer standpoint, a lot of times people are just struggling with appetite in general, low appetite or pain with eating sometimes, or even GI disturbances with eating because maybe there's insufficient enzymes being released by the pancreas at that time. So we work with people on really tailoring eating patterns and specific food choices with pancreas cancer specifically, just based on tolerance. Esophageal or stomach cancer, sometimes that has to do with the ability for food to just efficiently go down. So sometimes people feel as though food is sticking. So we have to adjust food textures and quantities for esophageal cancers. And then sometimes with stomach cancers, we find that if you eat too much, it physically fills the stomach and it really hurts. So a lot of times people with stomach cancer have a hard time tolerating large meals. So we have to shift to smaller meals. When we talk about strategies to help optimize eating, even though you have to eat smaller amounts. And then colon and rectal cancer, I find those ones can be all over the place. A lot of the times from a colon and rectal standpoint, it's going to be more GI distress, whether it's diarrhea or constipation or obstruction risk. So we adjust food choices, textures, just to allow for easier passage of food throughout GI tract.
Right. And so I think, I wanted to spend a little more time on this because this is I think the important part of this
Mhm.
top of this presentation today. So how can we address the most common nutritional concerns for patients? And these are just a list of the ones that I hear the most about in clinic.
Yeah.
But you can feel free to add any others that you hear in your
Mhm.
consult with patients. I
Yeah.
think the most common one I hear from patients is I am not hungry and I'm
Mhm.
losing weight. So maybe we can start there.
Right. And the first thing I say to someone that's telling me, I'm not hungry, I don't have interest in eating, I tell them, I'm like, unfortunately, food cannot increase your appetite necessarily, but we
Mhm.
can adjust the way food is being presented and the types of foods that are being presented to make them at least more appealing and easier on someone. So, one of the big things that I find is if your appetite is low, the last thing you want to do is look at a big plate of food in front of you. It's overwhelming, it's overstimulating. People are more likely to push the whole plate away than even take a bite. So, it's easier to present yourself with a quantity that visually you can do. So it might be a half or even a quarter of a sandwich, but you look at that and you're like, yeah, I can give that a try. You can always get seconds if you're still hungry, but you can't take the food away if there's too much presented at one time. So, the challenge though, if you are eating smaller amounts more often, you have to be more structured. You cannot forget to eat because you're not going to get that hunger sensation to remind you, oh, it's time to eat again. So, you have to time it. So, ideally, I encourage people to try to eat about every 2 hours. And the reason why I say every two versus 6 or 8 meals a day is you don't have to count. You're either eating on an even hour or on an odd hour, and it's harder to forget. So
That's true.
it's just easier just to schedule it similar to you do your medications. Just try to eat something every 2 hours. And then if you're not willing to eat, you can always drink something with calories, whether it's those protein shakes or smoothies or milkshakes or even a nice bowl or like a mug of soup. You can always drink if you're not willing to eat. And then last but not least, if your appetite is low, the last thing you want to do is sit there and chew on something. So make all your food soft. See if you can make things a little easier. If you can add a little extra mayonnaise or oil or butter or Greek yogurt to a meal, it's going to make it moist, softer, and easier to eat.
Do you give patients a goal of calories for the day?
It depends on the person. So sometimes people like to see a calorie goal. Sometimes a calorie goal is a little bit overwhelming. But typically, what I say is if you're trying to eat about every 2 hours and you are intentionally adding a protein source every time you eat. It might be an egg, it might be a piece of cheese, it might be a couple slices of chicken. But if you're intentionally adding a protein every time you eat, you'll likely hit your protein needs. And then see if you can add a little extra savory to it. Can you put a little extra cheese on top? Can you put a little cream on it? Can you add some avocado? By adding those healthy fats, or honestly, even sometimes it's not always the healthiest fat in general, but a small amount will go a long way in increasing your calories overall. So I typically don't provide a calorie goal, but calorie needs are high during treatment. So by scheduling meals and being intentional about protein sources and fats, you'll likely meet your needs at that point.
So helpful.